everyone. Welcome to Facebook Live with Avant Healthcare Professionals. My name is Stephanie, and joining me today as our special guest is Delisa Gale. She is our Clinical Preparation Program Manager, and I cannot wait for you to hear all about Delisa. Some of you watching already know her, but those of you that don't, here she is today. And I can't wait for you to tell our audience more about you. So, Delisa, feel free to just start and share a little bit about yourself.
Okay, so my name is Delisa Gale. Well, Stephanie, thanks for having me today as a guest. So I was actually born and raised in Jamaica. So my family migrated here. It feels like it was yesterday, but it was over 20 years ago now. And so I attended middle school here, high school, did college. I married, so I met my husband actually in high school. We went to college together.
Wow.
And now we have a very busy 2-year-old, going on 16, but 2-year-old. And so I love nursing, love to teach nursing. And so I just always wanted to be a nurse. And so I get to teach nurses every day what I love to do.
That's awesome. And we were talking earlier, and you had mentioned your 2-year-old's pretty busy, but very smart. She's already counting.
Yes.
That's pretty amazing.
Yes. To 20 and all her colors and her shapes.
Wow.
It's impressive.
That's awesome. Well, I'm so excited because it's been such an amazing program that you've been part of. And so could you share a little bit about your role, what you do here at Avant, and I also want to hear more of your nursing background.
Yes. So here at Avant, I'm the Clinical Preparation Program Manager. I've been here for some years. And so prior to that, I was teaching in the Clinical Transition Program, which is 3 weeks when our nurses get here to the U.S. And so I was able to learn a lot about their stories and what the differences in practices are. And so when I transitioned to teaching our nurses pre-arrival, I was able to take a lot of that knowledge to build on the program and just bridge the gap between their practice over there and what the nursing practice expectation here in the United States. And so I just always wanted to be a nurse. I always wanted to find a way to get people to smile and make them happy. And I understand that we cannot help what happens to us. We could try, but our health is something that is not in our control. And so that causes people to be sad and just sick. And I just always felt led to find a way to make them happy. And so I actually started working at the hospital. And very quickly, I, was a preceptor and a charge nurse. And I realized that maybe I had something different than other nurses. And so I was able to teach that, right? And so I like new challenges and I get bored easily. And so as well as working at the hospital bedside, I was also working at Avant and teaching. And so I decided I loved Avant a lot more. And nursing didn't have to just be a 3-day-a-week bedside career choice. And so I was able to bring all of that knowledge into Avant and just teach people how to be happy and just remember why they became a nurse. And I just think that nursing is just a really important job. It's very rewarding. And so there's very few careers that you could feel that way. And so as a nurse, I think that, it's the first and the last face that a human being might see when they enter and they exit life, right? And so you get the opportunity, right, to make a difference in somebody every single day. And so I think that's what led me to be a nurse. I am a med-surg background, and that's because, med-surg nurses, they get a little bit of everything and everyone, all the conditions and things. And so I was able to explore that and have fun and then bring that fun to Avant every day. And so that's my little nursing background.
That's awesome. Well, first of all, I'm getting to know more about your story. I didn't realize that you were working and working at the hospital and Avant at the same time. And by the way, it's very easy to smile when I'm around you because you make it that easy. So
I can't stop smiling. Always a reason.
It's great. But I love the fact that that's your heart, that as a nurse, you want to help people. And, you mentioned something I think that was really important for our international nurses is that gap. And so can you share a little bit more about the gap? Because I think that I think it's something that people don't quite understand is that there is a gap coming from another country to working here in the U.S. So what is the gap? Or what are the gaps?
Absolutely. So I realized just working in the transitions program here that although our nurses are really experienced, they've been nurses, for 2, 3, 10, many years, it's just a difference in practice, right? So I think here in the United States, a lot of emphasis is placed on the patient's overall experience. And so patients here are very involved. They want to be involved in their care. They want to have priority treatment. They want to feel special. So in other countries where nurses are able to be task oriented and they could just go in the room and say, I am the professional, I know what I am doing. Here, that really doesn't apply as much because you have to spend the time to let your patients know what you're going to be doing to them. It's their body, they have their decisions to make, and they just know what to expect. They want their patients or their nurses to wash their hands and wear their gloves and do the right things at all times, no matter how busy they are. They want you to treat them like they are the only person that you're taking care of. And so that may be different. I think our technology here is very advanced. And so in a lot of countries, they are writing information down and passing that off. But here, the expectation is that you chart, you document everything so nothing gets missed. We work as a team. So a lot of units will have physicians and CNAs and our techs and our LPNs, respiratory therapists. So a lot of those people are expecting the nurses to fill out the information so they could carry out their portion on our patients. So there's just many more of those gaps that we notice. We are working with a wide variety of people, so you have to over-communicate. A lot of the things that physicians will take care of in other countries is a nursing duty and expectation here. So nurses are expected to be more authoritative, like as far as their thinking process, identify changes quickly in a patient and do the interventions that will save their lives, right? So in other countries, I've heard that the physicians are right there. So as soon as you need something, you could go and say, hey, doctor, can you come? Can you do this IV? Can you look at this EKG strip? But in the United States, the nurse are with our patients for about 12 hours. And sometimes the physicians are only there for like 10 minutes. So you need to know your stuff and you need to be prepared. And so you need to be able to, based on the unit, understand what the EKG rhythms are so you could quickly, take care of your patient before anything happens.
Wow. So it sounds like it's a wider scope compared to what they're used to.
Yes.
So, and this was the reason why the clinical preparation program was built in the first place. So could you share a little bit more about the program?
Yeah, so we have a distance learning program here. Obviously, our nurses are not here in the United States as yet, but we take the time to maximize all their time that they have back home before they get here. And so the goal and the objective is to prepare them with the learning tools they need before they come here. So clinical knowledge, all our education is evidence-based practiced. And so we just want to make sure that our nurses are prepared in advance. It's to promote competence as well. And then to just overall, generally, we want to make sure that they know exactly what to do or how to react in situations to save their patients' lives.
It's a fantastic program.
Yes.
Yeah, it is really amazing how you help develop this program to really get these nurses, as you said, prepared to go on assignment.
Absolutely.
Because what a transition from their home country clinically to now coming here and having to practice and all of those gaps and being able to have that time to prepare and be, ready for their job assignment. Because really, our nurses' success is really our success.
Absolutely.
And so, That's an amazing program. So what do you love most about working here?
Everything, actually. So I get to just meet new people. It's just so nice. I know in the bathroom all the time I see our nurses and they're like, hi, I remember you, teaching us things. I get to hear their stories. I get to understand just those gaps in what is available in other countries. I know that we have a lot more resources here in the United States. We are just more advanced. So I really appreciate just using my journey and things that I have learned to train somebody else and just meet people from all over the world and just hear about all the challenges that they have overcome. And it's just really inspiring for me.
Well, it's inspiring to hear your passion for, really helping our nurses. It's really changing their lives, helping them become clinically prepared, especially for career advancement. I mean, I'm listening to stories about nurses getting 5 nominees for Daisy Awards. I mean, it's amazing. And that's really in part the support that you've helped provide them and get them ready for here in the U.S. So I want to say thank you because
thank you for having me.
Yeah, absolutely. It's just awesome that we get to have such passionate program managers helping our nurses get ready for life here. And it's an honor to be working with you and to seeing many people's lives changed. And you mentioned earlier seeing nurses in the bathroom. For those of you that are joining us, maybe for the first time or you've never heard about Avant, we do have an on-site orientation where we take our nurses through clinical and cultural transition training. And so that's what Delisa was talking about, seeing those nurses from over 60 countries come here to the U.S. and transition, and we get them prepared. So it is awesome getting to see them here in the office and meet them. So what advice do you have for nurses that are watching right now and are either contemplating coming to the U.S. or in the process coming to the U.S.?
I think they should come. I think the level of diversity that we have here clinically is just really important. So much more to learn. And I think my advice would be to remember your why. Why did you decide to become a nurse? Because nursing sometimes is not easy. It's not at all. But you have to remember that you get to make a difference. The work that you do is rewarding. You get to change a life. Every day you get that opportunity to do that. And so remembering your why is really, really important. Maybe they've done it because something happened to a family member or themselves and they want to be treated a certain way. So just take that into everything they do before they get here, doing their assignments, when they come here, just be as prepared as they can be. And then when they go to work, just remember their why every morning, every night that they're preparing for work.
That's great advice. And I think that's applicable for all of us to remember our why in life. And for us at Avant, our why is to help change lives. And we want to be part of changing your life. So if you're contemplating coming to the U.S., then we want to encourage you to join the Avant program. You will have amazing instructors and program managers like Delisa who are motivated to see you succeed and help you get prepared for your career and your life here in the U.S. So we want to encourage you to apply. And for those of you that are on our program right now, we cannot wait to see you. We can't wait to see you here. And we thank you for trusting Avant with your journey. And we really want to help all of you achieve your American dream. And with Avant, you can dream, become, and inspire. And that's what we would love for all of you. So we want to thank you for joining us today. We want to thank you again, Delisa, for being a special guest today. Thanks so much for joining us. Stay tuned on this channel so that you can get more updates and learn more about how you can achieve your American dream. Bye.